This is a case of a 56-year-old male with about 3 months of pain in the right Achilles tendon. He had an MRI before he saw me, which showed a longitudinal tear in the lateral aspect of the Achilles tendon, a full thickness type of tear. There was no injury to his Achilles tendon. He was functioning fairly okay, but was still having pain with ambulation. Ultrasound did clearly show this longitudinal tear in the lateral aspect of the Achilles tendon, and during the visit we basically needled that part of the Achilles tendon, tried to elicit bleeding and a healing response in that part of the tendon to help control his pain. I didn't think he required any kind of surgical intervention. And this fairly simple procedure using ultrasound did provide significant relief for the patient, which I was able to see on follow-up visits. Here we are looking at the Achilles tendon, the distal aspect of the tendon specifically, and you can see the plantaris tendon just on the medial aspect of the tendon. Now we're removing most of the surrounding structures, and we can see the undersurface of the Achilles, or the very anterior aspect of the Achilles, where you can see this full thickness longitudinal tear along its lateral aspect that this patient suffered from. Now we're removing some of the very anterior layers of the tendon, and you can see again this tear that's essentially penetrating through the entire thickness of the Achilles tendon. Now we're putting back that very anterior layer, and we're zooming out, and we're going to return the bony structures and surrounding anatomy. And here you can see a Haglund's deformity, which is again just prominence of that very posterior aspect of the calcaneus where the Achilles inserts. And this patient also has a Haglund syndrome, where he has enlargement of both the retrocalcaneal and retroachilles bursa in association with this Haglund's deformity. Now we're rotating and can see this tear from the head-on posterior perspective, somewhat covered by the retroachilles bursa. And here's Kager's fat pad that has been added. And now we're trying to move the lower extremity into the position of the procedure. And we're essentially going to go from a proximal to distal direction with the needle. The probe is going to be situated over the needle so the needle can be seen initially in long axis. So during this procedure we initially injected with lidocaine, which you can see here. And after the patient was comfortable, we proceeded with the ultrasound-guided needle fenestration. Here you can see the needle in long axis relative to the probe, but during the procedure also the probe was turned in an axial perspective so we can get a medial-lateral perspective where the needle is relative to the tear. But in this demonstration we essentially just have the probe in a sagittal perspective, which gives us a long axis view of the needle. Now we're going to make the superficial or most posterior layer of the Achilles translucent so we can actually see exactly where the needle is inside the tendon. And now we're injecting essentially saline into and around this tear to help elicit healing. This is our patient here for his right Achilles tendon. MRI does show a full thickness, partial longitudinal type, full thickness tear of the lateral aspect of the Achilles tendon going longitudinally. It does have a small amount of retrocalcaneal bursitis. I'm going to go ahead and just look at it on the ultrasound. I've seen just injecting saline into irritated Achilles tendons help. We may just try to do that. He had a cortisone injection about 2 months ago, which did not help much. I see a pretty swollen Achilles tendon here. He had an MRI. The MRI was about a month ago. The whole thing's been going on for about 3 months. Here's the distal Achilles tendon. You can see that it's thickened as it attaches to the calcaneus. It does have somewhat of a Haglund's type deformity of the calcaneus as well. There is a little bit of retroachilles bursitis actually. You can see a little bit of fluid, I believe, just superficial to the Achilles tendon. And also you could see his retrocalcaneal bursitis as well there. This is pretty mild though. And here we are, we're going up, and we can see the tendon becoming thinner and more normal looking. And looks basically okay. So it's hard to see this partial or this actual full thickness tear on the sagittals. I'm going to start doing some axial views now. The left side of the screen is medial. Here we are, we're at the calcaneus. We can see that irregularity of the bone, Haglund's type deformity. Now we're getting into the Achilles tendon. You can see how thickened it is. Here we can see that split in it laterally.
I put in 25s.
So here on the axial view, it's very clear that you can see a longitudinal split through it. It looks like it's going almost across the whole tendon. It's pretty good approximately.
What is this?
Just going to inject with a little lidocaine. So here we are, we're injecting lidocaine just to make this procedure somewhat comfortable for him. Again, I thought I might be able to stimulate a healing response at this tear via a needling fenestration. It's important to go in line with the fibers, I believe. Sometimes if you want to just use one needle, you may have to oblique it a little bit, which is what we're doing now. When you do inject the lidocaine, it's probably better just to keep it more superficial to the tendon and not inject it deep in the tendon, as it may kind of inhibit the fibroblasts from helping the tendon heal. But then again, if you can't do a very good job without the lidocaine, then you should just inject it, I believe. You can kind of see my needle there, and I would like to actually move it laterally into that intrasubstance tear, or maybe that full thickness kind of longitudinal tear, the lateral aspect of it. Maybe stimulate some healing. This is where you really need to do this on the short access to the needle, because otherwise it would be really hard to see that tear, I believe. Clip again. Here we're right really in the tear. So sagittal view of the tendon is good to see the needle, but unfortunately you can't see the tear well. Again, the tear is best seen on axial view. We're on sagittal again now. This is really right near where his tear is. And when you do these fenestrations, it's really good to go right to the bone, I believe. So we used about maybe 1 cc of lidocaine. You don't want to poke the bone because that's going to be very painful, but getting close to the bone, I believe, could elicit more of a healing response. No, not yet. I'm just going to inject a little water now, okay? Just to kind of clean things up on the top. Inject a little saline deep. Okay, the needles have to stay still. So 3 weeks into a ultrasound guided needle tenotomy of the right Achilles tendon, and how you doing right now? You said it's still...
Feels a little better, but it hurts every once in a while. It burns when I lay down or when I walk.
And okay, and how much better are you right now?
About halfway.
Halfway better. So it was worth it, the procedure. You felt it was worth it, doing what we did?
Yeah.
Okay.